In today's video, we will be learning about taking a patient's vital signs. Taking a patient's vital signs before doing any kind of procedure is important to us because it will help us determine if they are in the best condition to be getting any kind of procedure done for the rest of the day. The three main factors that we focus on when checking vital signs would be blood pressure, respiration, and pulse. There is also temperature, but in the dental office, those are the three common ones we focus. Blood pressure. When taking someone's blood pressure, we use a blood pressure cuff, or as its original name is shown on the screen. The cuff is usually placed on the brachial arteries, or it could be placed on the radial arteries depending on what kind of cuff you have, since there is the pumped one or the digital one that we most commonly use today. As you can see in the video, with my patient, I will be placing the BP cuff on its brachial artery since I have the digital one. As I place it, I make sure that it's tightly and insecure but not too tight where it's hurting them. And one thing to look after for is that the patient's legs are not crossed because it can affect the heart's rate. As I press start, I let for the digital BP cuff to start its process so I could get the results. Once I get the results and it's completely done, I chart it down to make sure that the doctor knows the patient's rate. Respiration. Checking a patient's respiration rate is the easiest vital signs but requires 100% of your focus. I will observe the patient's normal breathing from the chest area. Every rise and fall will be counted as 1 for 30 seconds. Always make sure to either look at your watch or your clock for 30 seconds to pass. Once I'm done, I will put down the rate number that I got, multiply it by 2 to compute the rate for a reading of 1 minute. Pulse. Same as pulse with respiration, it requires 100% of your focus. With the patient still seated, I will extend their arm and place my index and middle fingers on their radial arteries. Each pulse will also be counted as 1 for 30 seconds. Then I will multiply it as well by 2 to compute the pulse for 1 minute reading. And this is how you check the vital signs of a patient.